All right, hello, my name is Mitch. I'm going to be your student physical therapist assistant today. It looks that you have some increased kyphosis or bending forward in your neck. So I'm going to have you do some exercises for that, okay? To help get your shoulders back, to help with your posture. So I'm going to demonstrate real quick how to do that. They're called chin retractions. So when you do this, I want you to keep your shoulders back, okay, your head up, and then put one of your hands underneath your chin. And what you're going to do is just bring your chin straight back, okay, and bring it forward. So you're going to hold that for about 1 second back, and then bring it forward, okay? You're going to do that 10 times, and you're going to hold it back for 1 second, okay? And make sure that you don't roll your shoulders forward. That's pretty common, and round your back like that. You want to keep your back up straight. Okay. When you're doing that as well, you can focus on keeping your core tight, so your stomach muscles. Okay? You're going to do this twice a day, so in the morning and then at night before meals. And when you do it as well, you're going to do it You're going to do 3 sets of 10. Okay. So why don't you go ahead and do that exercise for me real quick? Yep, sitting in the chair. Okay. So and then also you can put your hand underneath and just bring your, like someone's got a string attached to the back of your head and pulling your head back. Good. How's that feel? Good? Okay, perfect. Okay, now for the next one, I'm going to have you do scapular retraction, so bringing your shoulders back with this IT band. And this is I'm going to start you at a low level of resistance, okay? And basically what I'm going to have you do is put an anchor to the post here, okay? Alright, and then, here, get out of the way of the camera, please. And then what you're going to do is you're going to wrap your hands around the band like so. You're going to have your feet shoulder width apart, elbows at your sides, okay? Head and eyes to the front, okay? Don't round your shoulders forward, keep your shoulders back. You're basically going to pinch your shoulder blades together, okay? Bend your knees slightly, okay? Always have slack on the band. You're going to do that 10 times. You're going to do it 3 sets of 10 times, okay? Do that twice a day, morning and night. Okay, you're not holding it for any particular amount of time, but do a smooth motion. Okay, go ahead and try that. Do you have any questions or understand it? Yeah. Like that? Yep. Good. Keep your eyes. All right, so this next one, I'm gonna have you do a corner pec stretch, and you can do this at home, okay? And it's gonna stretch out these muscles in your chest, because with your posture and your shoulders coming forward, these muscles are really tight. Okay, so this is a good one to do at home. Okay, so I'll demonstrate this one for you, okay? So you're gonna stand at the wall, at the corner of the wall, okay? And your hands are gonna be about chest level. You don't want them spread out too far, okay? And what you're gonna do is you're just gonna lean forward towards the corner of the wall, okay? You're gonna hold that for 30 seconds. You're gonna do that 3 times, and do it once in the morning, and then once at night. So 3 sets in the morning and 3 sets at night. And remember, this is a stretch, so you hold it. Okay? Okay. Okay, why don't you go ahead and do that for me? Make sure that your hands aren't too low. That's pretty common to have your hands too low. Good. You feel a good stretch in your back? You should feel a stretch back in here, okay, in your chest. Good. And a lot of the times, patients will get too close to the wall, so don't get too close to the wall. Feel a good stretch? Okay, hold that for 30 seconds. Okay, so since you can't bring your foot up as much as we would like and as much as you would like, we're going to do a stretch for it, okay? So we need to stretch this muscle back here, okay, called your calf. And so this is just gonna be for your right leg, okay? So what I'm gonna have you do is we're gonna use the wall, and your hands are gonna be about chest height, okay? And since you're stretching out your right leg, you're going to bring your right leg back, left leg forward, and your left leg is going to be bent, but you don't want to bend your knee too far past your toes, okay? And you want your toes to be facing forward in the same direction, so you don't want to rotate your foot out. And whatever leg you're stretching, you want to make sure that your heel stays flat on the ground, okay? So basically what you're going to do is you're going to lean into it, lean towards the wall, like so. Keep your shoulders up, okay? Good posture, okay? And you're just going to hold that stretch. And if that doesn't feel like a good stretch to you, what you can do is you can increase your step here, your step length, and then just lean into it even more, or lean forward farther. You're going to hold that for 30 seconds, okay? So why don't you go ahead and try that for me? Good. Make sure those, yep, your right foot's toes are pointing forward. Good. And go ahead, start. And lean forward. Good. And if you want more of a stretch, you just bend your front knee forward. Feel like a good stretch? Mm-hmm. Good, and we'll start 30 seconds. So you'll do this at home, okay, for 3 sets with a 3-second hold, or a 30-second hold, sorry. Once in the morning, and then once at night. Okay, so 2 times a day. Okay? Any increased pain at all? Nope. Perfect. Okay, perfect. All right, this next one I'm gonna have you do is gonna be a single leg stance. So you're gonna stand on one leg, and you're gonna stand on your right leg, since that's the one you're having issues with.
Okay.
And this is gonna help strengthen the muscles that help stabilize your ankle. Okay, because you have a lot of movement with it, okay? So you're gonna take off your shoe, like so. You can take off both shoes, is fine, okay? And you're gonna be close to a wall in case you lose your balance, okay?
Mm-hmm.
And what you're gonna do is you're gonna stand on the pillow with your right foot, okay? Again, head and eyes forward, good posture, keep your shoulders back. Don't lean, have a slight bend in your right knee, but not much of a bend, okay? So keep it fairly straight. And try not to touch the wall if you can, okay? Try not to hunch forward or lean to the side, okay? Just stay upright. And your ankle will move. That's what's supposed to happen, and that's working your ankle stabilizers. Okay? All right, so go ahead and try that one for me, please. Good. Feel your ankle and foot moving? Mm-hmm. Good. Okay, you're going to do this one 3 sets of 30-second holds, once in the morning and then once at night. And you shouldn't have any increased pain with this as well. Okay. And also, the foot that's off the ground, don't touch it to your other leg, because that can help with your balance. Good. Good posture. Not leaning much. That's good. Okay. Okay, good. Perfect. So for this next one, I'm going to have you do a stretch, okay? For this part of your leg here, which is called your hamstring. So it's the back of your upper leg. Okay, I'm going to have you do it twice a day. You can do it on a bed or a table, okay? But you want to make sure you have really good form. So I'll show you your form here real quick, and then I'll have you do it. So basically what you're gonna do, since you're stretching out your right leg, you're gonna have your left leg off the side of the bed and plant it on the ground. And you're gonna have your right leg straight, okay? No bend in the knee. And bring your toes down a little bit, point them down, okay? And what you're gonna do is you don't have to reach per se, but you're just gonna bring your hips forward, okay? Keep your shoulders back and keep your back straight, okay? And you'll feel a stretch right back in here, okay? You're gonna hold that for 30 seconds. Do that 3 times. Do that once in the morning and then once at night, okay? Don't round your shoulders forward. You're not grabbing, not rounding your back, because that can hurt your back. So you want to have good posture with this one. So go ahead and try that one, please. Good. Keep your shoulders up and just lean forward. Feel a good stretch? Perfect. Hold that for 30 seconds. You can point your toes down just a little bit. Not having any increased pain? Perfect. Okay, good. Okay, this next one is going to be a quad set, okay? And this is going to help strengthen the front part of your upper thigh for your right leg, okay? Because you can't get your knee straight. So what I'm going to have you do is roll up a towel roll, and this is for at home. You can do this at home, okay? And for your right leg, you're going to lay on a flat surface, could be a bed, table, okay? And you want to lay flat. What you're going to do is you're going to drive the back of your knee into this towel roll and straighten out your leg. Don't rotate your hip out and don't look up. Patients have a tendency to roll their neck up and forward. Don't move your hips at all. Stay flat on the bed.
One time each.
Okay?
10 sets of 10 seconds.
Okay. You hold that for 10 seconds. Okay? Good. All right, now you go ahead and try that. Okay? So you're going to do this 10 times, and each time you do it, you're going to do a 10-second hold. You're going to do that once in the morning and then once at night. Good. Any increased pain? Nope. Perfect. All right. So for this next exercise, you're going to do a straight leg raise because you have some weakness in your upper thigh, in the front part of your upper thigh and your right leg, and you're not able to also straighten your leg. So I'm going to instruct you on how to exercise and strengthen those particular muscles, okay? All right. So what you're going to do is you're going to lay on a bed or a flat surface, okay? You're going to be working the right leg. You're going to have your left knee bent, flat foot. Keep your neck flat on the pillow. Keep your toes pointed towards your knee and keep your legs straight, okay? And maintain a straight leg as you lift it up, okay? So you're going to go ahead and lift your leg up to about your other knee, so the same height as your other knee, and slowly bring it back down. All right, you shouldn't have any pain with this. And you're gonna do that 10 times. Okay? All right, so 3 sets of 10. So go ahead and try that for me, please. And let me know if you have any questions, and I'll watch your form as you do it. Good, bring your right toe, go ahead and start over. So bring your right toes back towards your knee. Good. Keep your knee straight, and then go ahead and lift your leg. About right there, back down, good. You feel a good, you feel your muscle working in your thigh? Good. So again, you're gonna do that 10 times. Now after you do that 10 times, you're gonna take a break, okay? And you're gonna do 3 sets of that, and once in the morning and then once at night before meals. Okay? Perfect, good form.